My name is Dr. Brian Paris. I'm a doctor of chiropractic. I initially practiced as a chiropractor and lived my own speak. So I've lived a very healthy lifestyle and at the same time helping people create solutions to living a healthier lifestyle with back pain, neck pain, shoulder pain, arm pains, you name it. I've created the Pain Arthritis Relief Center in Rockville, Maryland to have an integrative and comprehensive approach to overall healthcare. I found major limitations in just practicing chiropractic, just doing physical therapy, just doing medicine. So we combined all of it under one roof so that we can treat the entire person. All the meantime, I've been working on my own self. I'm a human experiment about diet, nutrition, movement, different therapies. I've helped probably 10,000 patients over the course of a career. I've made it part of my life's mission to get these therapies and this mission out there. I think people in our society need to learn a lot more about how to take responsibility for their own bodies, what the right foods are, what the right movements to do are, and not necessarily right, but the healthiest things they can do for themselves. I've had the privilege and honor of doing a TEDx talk, and that was on how posture relates to emotion and how you can actually improve your emotions by changing your posture. I've been on Good Morning Washington, ABC News, NBC News. I've been on many radio shows. I've had several publications all towards what people can do to help them live the healthiest lifestyles. Really, what can you do on a daily basis to get your body and your brain and your spirit working for you? Getting my patients back to a healthy, pain-free lifestyle really starts with understanding pain. And that pain actually is an emotion and it happens inside your brain. So we really want people to be able or give solutions so that people can get out of pain, whether it's an inflammatory condition or getting the right foods in their diet, getting the right stretches, or something as simple as learning how to breathe from your belly. We want to make sure that people learn how to take care of themselves. In the beginning of care in our office here, it's about we like to use the 80-20 rule, meaning that in the beginning, 80% of the work is done by us, 20% is done by you. But by the time you actually fire us, that's what we want you to do, so that you're doing 80 to 90% of the work and we're doing 10 to 20% of the work. It's disgusting what our system, that we've allowed our healthcare system to lead into, I think it's 16 deaths per day from opioid abuse. I think it's atrocious. I think it's embarrassing. As smart as we are as practitioners, greed has driven us to push our society into this addictive behaviors, taking these medications. And you're treating symptoms. You're not getting to the root cause, the emotional root cause, the physical root cause of these problems, nutritional root cause. So there's got to be something else that needs to be done. And that's really what our mission is here. We do things that don't require dangerous medications. We don't use scalpels. There are so many things out there that people can actually do for their health care that don't involve opioids, that don't involve non-steroidal anti-inflammatories, they don't involve painkillers, and they don't involve surgery. So I urge you, look out there, find out what's available, because the internet it's got it all out there. You don't have to believe me. Type in death by medicine in the internet and you'll be able to see the statistics. I'm not a statistics guy. I did well in school, but that was a long time ago. So the numbers are out there. There are more people dying from adverse reactions to medication than almost any other cause, more than heart disease and cancer, and probably motor vehicle accidents. So NSAIDs are destroying people's stomach linings. Opioids are getting people into addictive patterns and behaviors. And again, they're just covering up the symptoms. They're not helping you get to better movement patterns, better nutritional habits, better thought patterns about your pain and your body. So I've seen great results when patients take responsibility. And what I mean by that is that they make it a habit in their life. It's very hard to change habits because we were taught one way to eat and move and think. And when people take responsibility and put things like chiropractic, postural awareness, physical therapy for strengthening, even doing regenerative orthopedics for injured joints, and then changing their diet, putting the right supplements in, it's a whole process to get your body moving and your brain working as good as it can be. It's always very interesting when you compare medicine and chiropractic, and they're actually different fields. Some of you out there watching this might not know that chiropractic and the medical field are completely separate fields. And our training is different. Our ability to connect with patients is taught in education. The way that doctors are trained, and this is changing because I meet younger doctors who are more empathetic with their patients. They're more into nutrition and things like that. But traditionally, chiropractors have the education of holistic nutrition and how gut function relates to spine function and body function. So we're looking at the whole big picture versus just the symptoms in one segment of the body that may be dysfunctioning or expressing disease. Hope is the most important thing that I can provide to someone as a healthcare practitioner, because I think traditional medicine is trained in the world of the nocebo effect, meaning like you have a pathology, something is wrong, you are never going to get better. So hope provides the placebo effect. I think there is so much out there that the general public does not know about. This office, we don't have the advertising budget of Big Pharma. Big Pharma is able to put these incredibly brilliant psychological messages to tell you that taking this pill will help you with erectile dysfunction, or it'll take your back pain away, or when you have pain or those other symptoms, it's telling you that something is wrong. So I urge everybody, go out, talk to your friends who have gone to a chiropractor, talk to your friends who have gone to an acupuncturist, read on the internet. There's so much information out there, and there's so much that you could potentially be missing out to help you get healthy without getting sick.